You are in a minority.
I don't contest that. I'm just saying, if you want to talk about why disease mortalities disappeared in the 20th century, it was not vaccines.
In your book, you wrote, and I quote, "A doctrinal canon of the germ theory credits vaccines for the dramatic declines of infectious disease mortalities in North America and Europe during the 20th century. It will therefore come as a surprise to learn that it is simply untrue."
80% mortality in chronic disease that took place, in mortalities from chronic disease that took place in the 20th century, that almost none of it was attributable to vaccination. It was attributable to hygiene, to sewer plants, to better water supplies, to engineering that got oranges.
Thank you very much, Mr. Chairman. Good to see you again, Secretary Kennedy. Let me just respond to the chairman. A strong majority of the American people believe that it is women who have the right to control their own lives, not government. And I happen to believe that is where we should be going as a nation. That's a choice of women, not the government. It is no secret that the American healthcare system is broken. Every place I go, when I speak, I ask people to raise their hands. Conservative areas, progressive areas, people understand that there is something fundamentally wrong when we are spending twice as much per capita on healthcare as the people of any other nation, and yet 85 million Americans are uninsured or underinsured. We pay the highest prices in the world for prescription drugs. Our life expectancy is significantly lower than other wealthy nations, and for working class people, it is 6 years shorter than for wealthy people in this country. System is broken. It is designed to make the insurance companies and the drug companies extremely wealthy, and that is what's happening, and ordinary people are being left behind. I would have hoped that we would have an administration that would stand up for average people and say, you know what, let's do what every other major country on earth does, guarantee health care to all people. I think that's a radical idea. Every other country on earth does it, and they spend substantially less than we do. And yet we are moving in exactly the opposite direction as a result of the quote-unquote big, beautiful bill. 15 million Americans have been thrown off the health care that they need. But that's not the only problem that we have with what Secretary Kennedy and the President are doing. I talk to doctors, as I'm sure everybody on this committee does, in my own state of Vermont and all over this country. And doctors are extremely concerned by many of the actions that we're seeing from HHS and the CDC. They are concerned that Secretary Kennedy has directed the Centers for Disease Control to publish false information on its website suggesting that childhood vaccines cause autism, despite the findings of more than 40 scientific studies in 7 countries that there is no link between vaccines and autism. We have seen HHS spread misinformation about the safety and effectiveness of the measles vaccine during the largest measles outbreak in the United States in over 30 years. We have seen HHS remove the director of the CDC because she refused to rubber stamp the very dangerous and unsubstantiated vaccine recommendations coming from the agency. We have seen the agency defund promising vaccine research that will leave us woefully unprepared. Mr. Chairman, you will remember a couple of years ago, we had the leading experts in this country, and we asked them, I think we all did, do you anticipate another pandemic after COVID? And the answer was unanimously, yes, there is a fear. Nobody knows when another pandemic will come. And we are now woefully unprepared to address that crisis if and when it comes. We have seen CDC and HHS under Secretary Kennedy's leadership. We have seen now 3,800 people in America have been infected with measles, the worst outbreak in over 30 years. Vaccination rates across the country are falling because parents, I think, are very confused about what they're hearing from Washington, and children are dying as a result. So right now we are looking at a healthcare system which is broken, and we have leadership in Washington which is making it even worse. And what I will chat with you about when I have my question, Secretary Kennedy, is things that you have written which call in doubt the very existence of the germ theory. which is the modern basis of modern medicine. Yeah, let's talk about that in a minute. But bottom line is, what we would like to see is a broken healthcare system improved. Most of us believe that healthcare is a human right, that all people should have healthcare, and that we need public health policies which keep our kids and all people healthy, not moving us in the other direction. Thank you, Mr. Chairman. Secretary Kennedy, thanks for being with us. In your book, The Real Anthony Fauci, you wrote, and I quote, "A doctrinal canon of the germ theory credits vaccines for the dramatic declines of infectious disease mortalities in North America and Europe during the 20th century. Most Americans accept this claim as dogma. It will therefore come as a surprise to learn that it is simply untrue. But, despite your assertion in your book, according to a peer-reviewed study in The Lancet, led by the World Health Organization's, vaccines have saved the lives of more than 150 million people and reduced infant deaths by 40% over the past 50 years. So my question is a simple one. Do you still believe that one of the central tenets of the germ theory, that vaccines sharply reduce infant mortality, is, quote unquote, simply untrue?
What I was saying in that book, first of all, the study you cited is a modeling study.
It's a what? Sorry?
A modeling study. CDC has actually done a real study that answers that question. It's called GUYER, G-U-I-E-R 2000. And it says that the 80% mortality in chronic disease that took place, in mortalities from chronic disease that took place in the 20th century, that almost none of it was attributable to vaccination. It was attributable to hygiene, to sewer plants, to better water supplies, to engineering that got oranges.
Just a sec, I have to interrupt you because I have other questions. You're entitled to your view.
That's not my view. That's CDC's view.
Well, you're entitled to CDC's view, but according to the World Health Organization and scientists all over the world, vaccines have played an enormous role in saving lives.
I don't contest that. I'm just saying, if you want to talk about why disease mortalities disappeared in the 20th century, it was not vaccines.
Well, you are in a minority of opinions.
I'm just talking.
All right, I got other questions. 1 second.
Science is not democracy.
Secretary Kennedy, you have talked about, I think correctly, the fact that a lot of our kids are eating ultra-processed foods high in sugar. We have, as you know, an epidemic in obesity in this country. We spend zillions of dollars dealing with diabetes caused by obesity. I believe that we should follow countries like Chile, Mexico, and put strong warning labels on products that will show parents about the nature of the food their kids are eating. So my question to you is, how long will it take before your agency puts strong warning labels on unhealthy food and beverages?
Early in April, we did our final regulations of finally having a definition for what ultra-processed food is. That is now in the interagency process. We have no control over what happens there with the other agencies. As soon as it comes back to us, we're going to do the labeling requirement.
All right, let me ask you this. President Trump's nominee for Surgeon General, Casey Means, told this committee that she agreed with me that junk food ads in the United States should be banned from TV. What do you think? Do you agree with her?
I would support that.
Good. In other words, what we are seeing now is these big food industry companies spending huge amounts of money telling kids to eat crap. And I think it would make a lot of sense if we banned those ads from TV. I'm hearing you saying that you agree with me on that?
The only hesitation I was we tried to do a smoking ban on TV, and the tobacco companies voluntarily came to the table, which was a good thing. And I think the same The same arguments apply for junk food. They're probably even worse for Americans than smoking.
Good. Well, Art, I would hope you take a leadership role in making it clear that we should get these ads, which, just entice kids, addict kids to really bad food, off the air. All right? Good. All right. Thank you, Mr. Chairman.
Who won the battle on germ theory? And is the unexpected alliance on food ads the real game changer? Let us know in the comments.